New warnings this morning on the number of testing kits available to Australians.
One health expert is lashing the government's response, warning the crisis is far worse than we're being told. Professor Bowtell is a leading infectious diseases expert who advised the Keating government and is currently under self-isolation at home in Sydney. Professor, good morning.
Good morning.
So can I ask, why are you so critical of the way the government is handling this crisis?
The government had a chance to prepare for this crisis in January and February. Like Taiwan, South Korea, Singapore and Hong Kong. It chose not to, deliberately. It adopted the so-called herd immunity policies that were they acquired from the United Kingdom, and they did not stockpile tests, not protective equipment. They didn't alert the public. They didn't undertake sanitisation, other measures of the sort that have worked so well in Taiwan. And here we are. The failure to do this is having dramatic consequences in Australia and, of course, particularly in the United Kingdom, where this policy has resulted in even fewer tests than there are here, no protective equipment, and an epidemic that is out of control there. Now, this is in history, but we have to take steps today as people, as concerned citizens, to rectify the failure of government policy. The most important thing to do there, of course, is to wind down the schools at once. I'm very happy to see that Prime Minister Johnson has shown wisdom and strength and leadership and shut down the United Kingdom schools.
I mean, the real fear here is that we've been talking about is this level of under-testing. I spoke to a GP yesterday who said she's sending patients who had the symptoms to hospital and they're being turned away. Correct. I mean, do you think the number of cases in this country is far higher than we're being told?
Well, obviously, the number of reported cases is only a fraction of the number of actual cases. The 267 cases reported last night in New South Wales is some percentage, is going back 1 week or 2 weeks. So there are more cases out there than not. The way you find out is to test. I'm aware of reports in Brisbane and Perth and other areas of Australia where, as you say, no tests are being given as a matter of policy. The reason no tests are being given is not because that's run counter to the WHO recommendations and guidelines. There are not enough. I think it's beyond time for the Prime Minister to say today how many test kits are there in Australia, where are they, and how will they be allocated and rationed over the coming weeks until we can build up our test kit stocks. This information is secret. It is being kept secret from the Australian public, and as a matter of deliberate policy. I'm afraid that it is not good enough.
Bill, you know that I've been concerned for some time about our approach to schools and particularly our children, the way that they're saying kids will be able to handle this a lot better than us and the associated effects of that and flow-on effects of that. I've been really worried about it. I was looking on the internet last night and I found some disturbing figures from inside the Wuhan province, and they were reported in the American Pediatrics Journal. This is what we found out. This is also, by the way, acknowledged by the World Health Organization. 2,143 children were studied. 90% showed mild or no symptoms at all. That's consistent with what the government's been saying. But worryingly, the study also showed that almost 6% of children went to develop serious and even critical illness.
Yeah.
Now, that to me is a huge concern, especially given the strategy on children. What are your thoughts?
Well, it is a huge concern, and as this is a very dynamic thing. Now, I'm not a virologist or an epidemiologist. I have very great experience, however, in organising the public response, the government and community response to HIV/AIDS in the 80s. We took the advice of experts, of people who knew what they were saying and doing. Viruses, I think, present differently in different countries. The age profile of infection in France is very different than the age profile of infection in Wuhan. And you have that information that children are more susceptible to this than clearly forms the advice going to the Prime Minister from Professor Murphy.
Professor, where do you see us in a week or two?
Well, look, I hate to say this, I can't predict the future. Nobody can. But we are presently on an exponential growth rate. The Health Minister of New South Wales admitted as much the other day. The Deputy Chief Medical Officer the other day said blithely, as if it was a walk in the park, well, we might have 20% of people infected. This is part of the policy that they are following. I don't accept that we should do that. I believe that today we should bring down people going to school. They should become places to look after the children of essential service workers. It should be for parents who cannot actually be at home, but in a calm and controlled way, withdraw from that physical interaction. We will find out in months and years to come what and how the virus spread and who it infected. It's a bit beside the point today. Now, I noticed the Archbishop of Sydney, on the advice of the Chief Medical Officer and the federal authorities, said that Catholic schools should stay open. I respectfully say to him, look again. I think you are wrong.
Well, there seemed to be something going on there with that decision-making, because the schools have made their own decisions that they were closing, and then the Prime Minister leaned on the Archbishop, and then suddenly the schools are open again. So there's obviously... Yeah, go on.
We have no room in this for politics.
Yeah.
The strong and wise decision, the prudent decision, is to wind down the schools now. I can't predict the future. All I can say is if we plan for the worst, as we ought to have done from last January, but didn't, but if we now plan for the worst, by taking prudent and sensible action now, we can avoid the worst. That's what they did in Taiwan and Hong Kong. That's what they didn't do in the United Kingdom. And I'm afraid that's what they didn't do here. I believe the people, the Australian people, a lot more than the politicians.
I mean, your issue is, though, Professor, if you shut schools now, as the Prime Minister made clear yesterday, you're not shutting them for a week or two. 70 countries around the world have tried this sort of 2-week lockdown and it hasn't been that effective. If you shut schools now, you're shutting schools for 6 months, and I don't know any family who can cop that.
With great respect, how would the Prime Minister know? What qualification would he have to say such a thing? Can he say it's 6 months or 2 months? All I know is if we take the short, sharp, advised measures that is being adopted in the United Kingdom overnight, we will come out of all of this sooner rather than later in a lot better condition than not. You have to figure out this every day, but you do have to be ahead of the curve. We ought to have done this last week. On Friday last week, the Prime Minister was carrying on about coming down with meetings of 500, but not on Friday, but on Monday. Now, I mean, the Prime Minister's advice on this and Professor Murphy's advice on this and social distancing changes from day to day.
Yeah, we certainly seem to be moving fast towards what you're recommending. Bill, thank you for your time today. Appreciate it. Thank you. And look, there's a lot of heat in this debate on all sides, isn't there? I don't think none of this is easy for our leaders. I think it's perfectly fine for us to debate, to present alternate arguments, and to present research in either direction. But at the end of the day, as long as we're able to accept the decisions that are being made and move forward. Otherwise, it's going to lead to a lot of angst between people, and we just don't need that at the moment. But we have to rely on the medical opinion, but there are divisions inside medical opinion as well, and so we're just presenting those. You're
just sort of assuming too that the Prime Minister is sitting there with the chief medical officers from every state and territory, that they're getting information, they're privy to information that we are not. So I do think that we just have to be led by them, and they're making the best decisions at the best time, and that might change, and our schools might change in 2 weeks. But clearly what they're being told is that right now that's not the best decision.